Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are talking about addictions and specifically people who use drugs or alcohol. Often, these people are assessed by a doctor or mental health practitioner and diagnosed with addiction issues. With me today, I have Dr. Lynette Hillsberg, who will explain what this means. Welcome, Lynette, and thanks for chatting.
Thanks, James. It's a pleasure to be here.
So, tell me, what is the issue around using drugs or alcohol? I mean, most people use alcohol, and a lot of people use party or recreational drugs. It's now quite acceptable. Why would this be a problem, and how would that lead to addiction issues?
Okay, I'll tackle one question at a time. Yes, a lot of people use alcohol as part of our culture. It's acceptable to have a few drinks after work with your friends. The thing is, when you have one or more, you become intoxicated and become different to how you normally behave when you're sober. So you may or may not be aware that your behaviours change and may feel that you're in total control of your emotions, behaviours and actions.
Yes, that's right.
The thing is, the insight that you have will depend on the situation you're in. If you're drinking by yourself, watching TV or listening to music, then your mood will be one that's not elevated or stimulated. You could just get drunk and fall asleep. If, however, you're with a group of friends who are at a rave party, a nightclub, or doing a pub crawl, then everyone else is drunk, then you'll be alert, you'll be elevated in mood, maybe excited or overly stimulated by the alcohol or drugs, and this will intensify your emotions and you'll become quite reactive to everything around you. If you feel happy, then you'll be overly happy, and if you feel sad, the emotions will be exacerbated. Depending on the situation, you could become so sad that you could have suicidal thoughts and could act on impulse because you're just not thinking clearly, because you just don't have the rational or logical thought process that you normally have that when you're sober.
Yes, I get that. You go out to have a good time, so what's the problem?
Well, the risk of harm to yourself and others is increased. That's because of the condition you're in. And it's purely because of your intoxication, altered mood and the inability to rationalise the situation, where you become a risk taker, think you're invincible and that nothing's going to harm you. One example is drinking and driving. You may feel that you're not drunk and you'd be okay to drive. And then because your reaction time is slowed because of the alcohol, you then have an accident and hurt yourself or someone else.
So, what about drugs? Are these all the same and affect you like it does alcohol?
Okay, so there's different drugs with different effects. Not all drugs are the same, and we can group them into three different categories. The first one is opioids, such as heroin or morphine. You can either inject that or sniff it or heat it up. Same thing, morphine, you can put it into an IV, you can smoke it or take it. It alters your body. You've got stimulants, and there's methamphetamine, cocaine, well, you can smoke that. You've got MDMA, ecstasy, which you can smoke. Same thing, drugs. Take them in pills, inject them. It make you very much aware and full of energy. You've got nicotine, caffeine, and cannabis. Okay, you've got sedatives, and that's alcohol, GHB, and the other name is fantasy. They're pills, powder, you can inject them, or you can take them in other forms. They affect your mental capacity, make you relax. You can drink it, and it's a drug. You've got hallucinogens, and they're the same thing as LSD. Again, you can put them in tablet form, drink them. You've got ketamine, and that's the same thing. It's a powder. You can drink it. It's a pill. It affects your mind, makes you aware, makes you feel really different. The way you look at the world's different. You've got hazards, and that's inhalants. So you've got spray cans that you can smell. There's paint. There's different type of paints that you can smell, inhalants. You've got solvents. That's like your nail polish remover. And then you've got camping or lighter fluid. And also you've got petrol, and that can actually make you feel weird.
Wow, that's a lot. I had no idea.
Yeah, there is, because there's so many. I'll only talk about just the alcohol, nicotine, and the effect of the illegal drugs.
But some of these drugs are legal, right?
Yeah, the use of legal drugs such as caffeine. There's nicotine and alcohol, and that's very common. Most illegal drugs tend to be used by a really small percentage of the population. The chances someone will develop an addiction to these drugs varies greatly, and based on how the drug affects the brain. It's important to know that illegal drugs are not necessarily the most addictive.
Interesting. So how do drugs work?
Well, drugs can either excite, relax, or distort our sense of reality. And they also have a combination, it could have a combination of these. So they do this by affecting the normal range of neurochemicals in the brain. And these are called neurotransmitters. So these transmitters are then responsible for moving the drug-affected neurochemicals around your brain and your body when you smoke or drink. This then triggers a physical response, resulting in a really pleasurable experience.
Right. So the drugs affect the brain and body, giving you happy feeling. So why would this be a problem?
It's because the tolerance and build-up of the drug in the body. I'll explain it. So when we take drugs, the amount that we take can activate a chemical called dopamine, and that's in the brain. That's for when we drink or we smoke, take coffee. The time it takes for the dopamine to have an effect on the body and the potential for addiction is quite easy to understand.
Do you have an example of this?
Yeah, it only takes 1 cup of coffee every morning, every day, for a week. And that the body will then build up a tolerance to caffeine. If it's taken first thing each day, then the body chases that initial rush, and this is repeated every day. The caffeine changes several of the neurochemical systems in the brain and body, and so the person may need to have more and more caffeine to experience this kind of rush. And with repeated use of this drug every day, the intensity of the effect reduces, and this is called tolerance. Once the caffeine is withdrawn from the body, it takes time to normalise, and you'll experience withdrawal symptoms. And in some, it can take a very long time to function normally again as your body recovers.
So this is why I have a headache each morning until I get my coffee.
Yeah, absolutely. A lot of people go through the feeling every day, which is why a lot of people have an addiction to caffeine.
So what about smoking? Is it the same thing?
Okay, so the major component in cigarettes is nicotine, and this is inhaled. It enters the bloodstream through the lungs and into the body, and it's widely distributed. Nicotine reaches the brain within seconds after cigarette smoke is inhaled.
Wow, I didn't realise it was that quick. So why do people feel the need to smoke regularly during the day?
There's also receptors called agonists, and these are triggered in the brain by nicotine, and they're similar to the alcohol receptors or the reward system that nicotine triggers when taken. Once the active components in nicotine are excreted from the body at a constant rate during the day, the levels of nicotine in the body drop and the person feels the urge to use again.
So how long does it take for this to happen? Because I often see people hurrying on their break to light up.
Well, that's a good question. Half the nicotine is excreted after about 15 minutes. Then another 50% after around 2 hours. So this is when the person may crave another cigarette.
So let me see if I've got this. Nicotine inhaled from a cigarette triggers the reward system. It leaves the body after about 15 minutes. The reward system notices this. It then triggers an activation switch, which leads to a craving for more nicotine, and this explains a need for another cigarette.
Yep, that's right.
And what about alcohol? Does this work the same way? And what effect does alcohol have if I drink it every day?
Okay, so most drugs of abuse can cause an activation of this dopamine system in the brain. And that's involved in the compulsive use of drugs. So with alcohol, the effects start within 5 minutes of taking the first sip. And the full effect will peak around 35 to 40 minutes after the first standard drink.
So what happens to you?
Well, low to moderate intake of alcohol can cause just relaxation, feelings of well-being and decreased inhibitions.
And why does this happen? Is it the same receptors as the others?
No, there are different receptors in the brain for alcohol. Gamma aminobutyric acid, or GABA. These receptors are then triggered rather than excitement. It causes a general depression of the central nervous system, and this results in intoxication. So from this you get poor judgment, loss of self-control, slurred speech, unpredictable behaviour, risk of injury and potential for aggression. If you use alcohol long term, it can lead to heart disease and liver disease, stomach ulcers, brain injury, including early onset dementia and other various cancers.
Okay, so what happens with the illegal drugs?
With repeated drug use, that your brain becomes less sensitive to the effect of drugs, and drug taking may become more automatic.
Why do some people use drugs in the first place?
People use them for very different reasons. For example, to party, reduce anxiety, or to cope with previous trauma. And often are looking for specific immediate results. They want to relax, get some energy, or looking for mind-altering reactions. An additional effect of nearly all drugs of abuse is that they directly or indirectly stimulate the reward pathway in the brain.
And what are the risks of using drugs?
Well, the risk with illegal drugs is people don't actually know what they're taking or how much. For example, the ingredients for ecstasy is difficult to get right because it's illegal. The manufacturers just put in other stimulants or fill in the pills with unknown substances. The worst thing is you could die from this. I knew of one person who's had party drugs or put washing powder in it, and they ended up in hospital extremely unwell.
Really?
Yeah.
So why do people use, and does this mean they'll get addicted?
Well, there are two important factors in the development of addiction. Firstly, drugs are reinforcers and they make you feel good. You're likely to repeat the behaviour, which makes you feel good. And the dopamine trigger in the system in the brain plays an important role in this reinforcement of drug seeking and drug taking behaviours. And the second is the body adapts to the drug and experiences changes. Because then when the drug use is no longer about feeling good, it's about avoiding the negative feelings from withdrawal, like what happens when you have your morning coffee. The stress of this feeling in the body then triggers the cravings and leads the person to take more drugs to avoid the negative effects or withdrawal.
Okay. So why doesn't everyone become addicted?
Research of addiction is combining knowledge about hormones, neurotransmitters, and the immune system to better understand this complex disease. For example, many people try alcohol, but only a small group will develop an addiction to this. Genetics can also play a role, that's an addiction, and we may have genes that make us feel terrible when we drink, or increase in impulsivity and increase in reward after drug use. Everyone's different.
What is a sign that you've developed a physical dependence to drugs?
Withdrawal symptoms will happen when you suddenly stop taking the drugs. And when someone is trying to give up drugs or alcohol, it's important to understand that experiencing and feeling these withdrawal symptoms are a major reason that some people relapse.
So where can I get help if maybe I or someone I know has a problem with drugs or alcohol?
Well, the first thing is to acknowledge there's a problem. Asking for help is the next step, and this could be through online education, researching self-help techniques, linking to your GP who can help with symptoms via the use of medication. There's also specific treatment facilities, and they're usually attached to a hospital or community centre that you can stay in for a short time to detox safely. And long term, they're facilities that you can live in for up to 12 months, and this can rehabilitate your body and your mind. It doesn't matter that if you fail the first time, because every day is a new day to start over.
Thank you, Lynette, for this valuable information. It's helped me understand why I need my morning coffee now.
You're welcome, James, and I hope to chat to you another time about mental health issues.
Absolutely. See you next time.
Yep, see you soon.